The Californians pioneered plastic surgery. The Koreans are absolutely obsessive with skin. It seems that us human beings have an insatiable and voracious appetite for modifying our outward appearances. And most any part of the body can therefore be nipped, tucked, and tackled. You have large breasts, they ought to be smaller and they will be made smaller. You have small breasts, they ought to be larger and they will be made larger. Now, it may seem as if we are here in judgment and to deride this obsession with outward appearance, but that is certainly not the case, aside from the fact that medical professionals involved with this seem to get wealthier and wealthier. The fact is that it is a huge industry and it is one that seems to be inextricably tied with an individual's vanity and their self concept and self esteem. Um, Eyes and ophthalmology isn't very different. We have now had for some time interventions such as LASIK, where one can have one's power removed and therefore one's spectacles removed. And we would find it very interesting, therefore, to gain insights about the motivations of people who undertake these kinds of procedures. And to help us understand this better and navigate this vanity led maze is the brilliant Dr. Samaresh Srivastav. Aside from being a globally recognized expert in retractive and cataract surgery and the director of the hallowed Raghudeep Eye Hospital, he's also within their own organization pioneering what I refer to as cosmetic procedures in terms of ophthalmology. And so it'll be very interesting to sort of seek his observations and understanding. I'm very grateful that Dr. Samresh has made the time and has joined us. Welcome.
Thanks a lot, Karthik. Thanks for having me on Driveway Devi. I've been following your work for quite a while now, and I must say the diverse amount of discussions that I've gone through, listened to while with you and the people who are participating is truly educative, and it's been really entertaining as well at times because you get to see a different perspective of how things are being handled. So today I'm going to talk about your topic at hand, and just like you said, I've been into clinical practice for almost 16 years now, and starting from trying to understand what ophthalmology and disease, to understanding human beings and their personalities and the psychology behind a lot of things, has really changed me as a doctor and changed my perspective towards patients. So to answer your question, to understand in today's date and time, I would slightly disagree with what you said. It's no more a cosmetic procedure as LASIK is, because as times are evolving, we are so functionally dependent on our vision, and
Mm,
more so for the last decade in our near vision, because we are always glued to a screen. You
absolutely.
know, life is between screens, from a TV to a computer, and if you're taking a break, you go to your social media. So we're literally using our eyes much more than our parents or our
And the
grandparents.
phone, I mean, our lives are practically being run by it.
Yeah. You ask people how much phone they're using, and they'll say 2 hours, 3 hours. You
Yeah.
go back and look at the screens, and you'll realize average screen time is about 5 to 6 hours, and that's only the phone screen.
Mm.
So you can imagine how we are pushing our eyes to the limit at this point in time. So yeah, that's true. A lot of people who do turn up for LASIK now, LASIK surgery or refractive surgery, one form or the other, do come up because they really want to get rid of their glasses. It's a frustration, of these wearing these glasses all the time, and particularly for people who are dependent on them. So while lower numbers may not be dependent on them and they may need it for more clarity, people with powers higher than 2.5 are literally dependent on glasses. Otherwise, they're practically blind and they cannot maneuver themselves. People with numbers above 4 and 5 cannot maneuver themselves in their daily lives. So that's why a lot of people do turn up. But apart from this sect of people who come up with, say, higher numbers, there's a lot of people who come up due to their self limitation of expression,
Mm.
their handicap as the glasses that they're wearing all the time. Because today is a date and time where, look the way I feel phenomenon is around, and the social media is so, so immersive and so engaging. And you see a lot of these people who are not wearing glasses and doing things, doing a lot of uh, movement around, playing extreme sports, doing bungee jumping, scuba diving, snorkeling, and not depending on glasses. So that's one of the major reasons why people turn up is to improve their lifestyle, not only to just remove the handicap, but also to sort of upgrade their lifestyle at it.
That's a very, very critical point. But, I'm going to play devil's advocate here, so just bear with me. Ek to please shed some clarity on the fundamental and basic requirements that one has to meet in order to qualify for a LASIK surgery, because I think I might be right, wherein there is loosely an age range for a human being to get a LASIK surgery done. And because that age range tends to straddle and basically include a more younger demographic rather than an older one, by virtue of that itself, is it not fair to say that at least a portion of these clients of yours are indeed getting these procedures done, aside from lifestyle improvement and the frustrations of wearing physical glasses for the purposes of appearance and look enhancement?
Yeah. So I'll answer your first question first, and I'll make it a little broader. LASIK is one laser surgery. Let's keep it a very generic term as laser surgery for glasses removal. Is not a new surgery. It's been there for almost 2 decades and more. And now it's evolved to a level where it is prime. So we are not only doing vision correction, we are now doing vision enhancement. So as you would understand, as baseline, we've been taught that 6 by 6 or 20/20 vision is good vision. Well, I can tell you that with modern lasers, now vision can be better than 6 by 6 in more than 70% people undergoing surgeries. So they will read one line or two lines better than an average normal vision of a human eye.
Wow.
And that's the level we're at. And I don't think it can get any much better than this at this point in time. But the important thing is to figure out question number one, when it can be done and whether or not it can be done in your eye. So, to answer your first question, you have to be above 19 years of age because your body has grown till then. And for females, sometimes 20 years of age with a stable glasses number for at least 1 year.
Mm-hmm.
So, if your numbers haven't changed after 19 years for a whole year, it means the growth of the eye is stable.
Mm-hmm.
It's just like getting yourself a pair of jeans. And if you're 17 years old, chances are the jeans will run small for you when you grow up
Sure.
because your height's
Yes.
catching up.
Yeah.
It's the same with the eyes. After that comes a plethora of tests which your doctor will tell you whether you're suitable for surgery or not. And I think the most important thing apart from qualifying is also doing a little bit of background homework
Mm.
because the market is really primed with a lot of marketing right now to understand number one, it's the doctor that treats you, it's not the machine that treats you. So you have a lot of confidence and do a lot of homework about your doctor. How well read is he? And about the technology that he is offering. You don't want to be a guinea pig in an experimentally new technology, which is being promoted by some doctors around globally, and you want to be sure of what you're getting done. And rest assured, if you've done your homework and you've picked up the right doctor and picked up the right technology, you will enjoy good vision. So that comes to the diagnosis and the theory part. But when it comes to cosmetic purposes, as I said, it's an immediate boost in confidence, and particularly in social settings. A lot of us, like for us as doctors, we see patients throughout the day. But if you look at a lot of people, majority of people, their social interactions are limited to evenings and weekends now.
Mm.
And it is at that point in time when you want to feel the freedom of, seeing things clearly. So it eliminates those visual barriers of glasses and gives you that immediate boost in social settings. And that's primarily one of the reasons why people with low numbers also want to get their glasses removed now. Okay. Again, as I said, there's an increased engagement in life. So you want to do swimming, you want to play sports, you want to go tennis. You don't want those glasses slipping down your nose. You want to
Right.
run marathons and not have the barrier. And that's why it's important. A lot of people have also said that it reduces anxiety in them. Wearing glasses gives them a little bit of anxiety and makes them feel that they're hiding behind something. And
Mm.
those glasses gives them that added confidence. And seeing things without any barriers in front of them is a real confidence booster. one more thing that a couple of patients have told is that they're able to make better eye contact with people when
Hmm.
they're having conversations once they've removed their glasses. So
Right.
I
And
guess,
I suppose there, even if physically they are able to make the eye contact through the glasses, the sensation they get is of a lot more direct eye contact once they're not there.
I'm pretty sure, and also if you have thicker glasses, your eyes, even though your eyes may be right size, under the thick glasses, your eyes look small. So
Yes,
it's very
yes.
difficult for the person opposite also to make sometimes direct eye contact. So I think that's
Absolutely.
what this is one of the few reasons why a lot of people, do get motivated and rightfully so at today's date and time to get these surgeries done.
Those are amazing insights and very, very important. And in fact, I've been using that word very liberally, cosmetic. But of course, it is so deeply tied in to confidence and self-esteem issues that it's not at all superfluous. It's very much a deep-rooted sort of feeling that it gives rise to. Any specific instance that you can share, of course, without breaching any confidentiality, of a before and after scenario?
Yeah, so actually, the couple of them. I'll discuss two immediate scenarios. One is a person from our city only who's a very nice shooter. So shoots in ranges and is representing the state. And we performed a surgery for that patient a few years ago and went ahead and won the title in one of the competitive sessions. And I'm sure he would have won it without the surgery as well. But the fact that he had a surgery and he realized the barrier is gone between them and I think they were doing a trap shooting with a moving target. He was so thankful for it when he came back and said, no, it's because of the surgery. Although I'm sure he would have done it without
Yeah,
that
but
also.
that just proves the point that it is so psychological.
Yes, exactly. And the confidence that it brings in you, it really boosts up your morale and makes you think that you can do it. And probably in some cases it does too, scientifically speaking, but there is a huge moral booster. The
Hmm.
other is a young girl who had come to us with a -7 number and has always been behind glasses, a reader, always academic. And she was not very motivated for a surgery primarily. After 1 or 2 years of to and fro and discussing the potential, she went ahead and did a surgery. And I kid you not, when she walked into my clinic 6 months after the surgery, I couldn't recognize her. So she went in from an introverted personality to a completely extroverted, jovial, smiling, human being, which was, and this is not new. It's something
Hmm.
that we've seen over the years
Of
because
course.
it completely flips your personality as a human being. So yeah, there are many examples, and around, and this is how it's working out now.
Tell me, is it? Let me present a hypothetical scenario to you, and let's say there's a youngster who's really struggling with their confidence levels, are terribly sort of reserved, introverted, underconfident, and the immediate sort of caregivers or family or close friends feel quite strongly that this sort of procedure or intervention can really alleviate this individual's personality. Is it a good idea for them to, despite that individual not being terribly open to it, at least try and get them to a professional setup to have a talk about it?
I think that's a very relevant point. To be honest, a lot of people, number one, there is a lot of taboo around a lot of procedures. Even simple things like getting your hair dyed. For that matter, is a big taboo that you will lose hair or it will turn white, and we know none of it is true. Same comes with LASIK and refractive surgeries. So a lot of people, anyways, the personalities are shy. And there is no harm in coming and meeting a doctor and meeting a set of doctors if you're not sure, and taking your own sweet time to decide whether or not you want a procedure, because I think it's the conversation and the setting and meeting peers. So, like we encourage patient to patient interaction. A lot of patients who do come up and are unsure, I encourage patients to communicate with due consent from my operated patients to talk and understand their experience, good or bad. It's everything is to be understood. It's a doctor's responsibility and the institute's responsibility to educate. I think if not immediately, if people are good candidates for procedure, it will definitely benefit in life, and they do tend to come back again to understand, and most of them do go ahead and take this call on getting the surgery done. But
I
I
think
think bringing the to the doctor primarily is a great idea.
Hmm. I think it's plain to see no pun intended, that while the base or the primary motivation in many, many cases is not directly related to confidence, etc., that invariably that can be a happy byproduct in any case.
Right.
And so, therefore, as we wrap this up, I think it's very, very crucial, particularly in this realm of medicine, that, as you had briefly alluded to earlier, that people do a certain amount of due diligence very carefully. We would love for you to tell us, because you're in our city, and that is always extremely selfishly exciting that Jaipur has resources in Raghudeep. But what are some fundamental things to watch out for or investigate in terms of identifying a doctor and a setup to do this at?
I think that's the most interesting question of the hour. The first thing I will say is to not get swayed away by social media.
Hmm.
A lot of people, a lot of doctors, not naming anyone, a lot of organizations do tend to put a lot of budget on marketing. And
Hmm.
I think that although it's a great idea to educate the patient, it's not a great idea for the patient to get extremely motivated looking at before after pictures or by looking at sensationalizing celebrities coming and doing things.
Correct, correct.
I think after doing that, it's important to go visit the organization and look at the ethos of the organization. And one can realize how transparent the organization is about your investigations and what is coming up. Not every person is suitable for surgery, and the institute of the doctor has to be very upfront about it.
Hmm.
Because at the end of the day, it's beneficial for both doctor and patient to make a wise choice. But also go back and look up the consultant doctor's academic credentials, because a lot of the trade secret in doctors is the best doctors are the ones who are either good surgeons, good speakers, good published doctors, and those are the kind of people, because they are well read and they're in tune with the times, are the right doctors. Also, one last point about technology. And while it's great, when you're buying a new car, it's a great idea to buy the latest. When it comes to surgery, you want something which has data for at least 5 to 10 years. You don't
Hmm.
want to be the first ones to go ahead with the
So,
surgery because, it's not something that's been validated. So look for robust technology. Don't go with the fad of the latest and the latest in
hmm.
science,
Correct.
but
So, I mean,
transparent.
what if I'm hearing you correctly? It's one thing to be early adopters in different sectors, but certainly in this case, there are obvious risks associated.
Yes. Risks we don't know, but we are not sure of the long-term outcomes as of now.
Hmm. Lastly, and because you and I have sort of talked about this a little bit off camera, is it also not a good idea for people to be aware that don't blindly also go with the most inexpensive option?
So, and if anything is cheap, it's cheap for a reason.
Hmm.
And I think cost is the last factor one should consider in this. Cost can be a deterrent for many reasons, many if it's not in the budget, but that may not be the first cause of picking up an institution or a doctor. The first thing is due diligence. Costs are generally justified by hospitals, and if the cost is making sense, because it's not only your eyes, it's also the consumables, it's the doctor, it's the facility, it's the maintenance of the machines that's playing out a role. I think that can be worked because money is going to be spent only once, but the regret will stay for life. So it's
Hmm.
very important to make a wise choice when doing it.
Wonderful. That makes so much sense. Well, thank you. You've corroborated and confirmed our suspicions, and I do stand corrected. I came into this a touch cynical, but I see very, very clearly that even though the benefit or one sort of byproduct of this is outward and superficial in that sense, in terms of look and appearance, but it is so strongly tied in with how one feels inside, and then the general contentment and wellness that it brings to that individual's life.
Yeah.
Wonderful. Thank you very much. Have a lovely evening, and we'll be in touch.
Thanks a lot, Karthik. Thanks for having me here.